Hello and welcome to Outstanding English. My name is Todd Elprovitz. In today's lesson, we'll be going over some useful vocabulary about visiting a pharmacy. We have a lot of vocabulary items today, as well as 2 dialogues and 2 checks for understanding about those dialogues. So if you have any questions during today's lesson, feel free to leave them as comments in the chat or leave them as a comment for this video if you are watching the replay. So first of all, I want to go over some vocabulary items here today. Our first is our main topic today, which is pharmacies. And in America, these are called either a pharmacy or a drugstore, while in England, they are called a chemist. So a pharmacy is a place where medicines are prepared and dispensed. There's a slight difference between the word drugstore and pharmacy in America. A drugstore is more like the building or the area where the pharmacist works and dispenses medications. But sometimes you can also find pharmacies in large supermarkets. And in the people who work in the pharmacy, who fill the prescriptions, they are called pharmacists. And in England, they are called dispensing chemists. So our first vocabulary item, we're going to be going over a lot of different symptoms. And symptoms are the physical or mental features that indicate a particular condition, illness, or disease. They are observable or they are felt by the person. So what I mean by observable is you can see that someone has redness in their eyes, or you can observe that someone has a fever by using a thermometer. A symptom may be felt by an individual. You could ask them, how do you feel? And they may say they have a headache or they have a body ache. Those are symptoms. And we'll be going over a bunch of symptoms first. And our first one is a headache. And this is pain in your head region. And you can describe a headache as being a throbbing headache, or maybe you are experiencing a dull headache or a sharp headache. And with a sharp headache, it's like a pinpoint pain, while with a dull headache, it might be not as painful, but spread throughout your head. The next item here is a fever. We describe fevers as a high-grade fever or a low-grade fever. And this is anytime your body temperature is above normal. There are different temperatures depending on your age for what counts as a low-grade fever versus a high-grade fever. The next item here is a cough, and you may have a persistent cough, which means a cough that lasts many days. A cough may be a dry cough, or a cough may be described as a bad cough. And this is just air coming out of your lungs very quickly. And this picture shows just how terrible it can be to cough without covering your mouth. You can see all the saliva come out of this man's mouth as he coughs. And my next item here is a sore throat. So this is any pain in your throat, which is right here. And my next item for different symptoms is a runny nose. A runny nose is when you have a liquid discharge, which is mucus coming out of your nose, either through your nostrils, out your nose, or a runny nose, which drips behind your nose onto your throat. And this liquid may be clear, or it could be like a yellowish or green color. And that's pretty disgusting. Our next symptoms are body aches, and body aches are discomfort or pain affecting multiple areas of your body, including your muscles or your joints. Your joints are where 2 bones meet each other. And the next item here is fatigue. And fatigue is just a general tiredness, which could be the result of being ill. That would be fatigue. The next item for our symptoms is a stomach ache, and this is pain in your upper abdominal area. Your stomach hurts. And if a stomach ache is very serious, you might have nausea. And nausea is when whatever is in your stomach comes out through your mouth. So you throw up or you vomit. That is nausea. It's not pleasant. And the next item, also related to stomach aches, is you may experience diarrhea. Diarrhea is when you have to go to the bathroom and you can't stop going to the bathroom because it is coming out as a liquid. So it's very unpleasant to have diarrhea. That is a symptom. Another symptom we have is constipation, which is like the opposite of diarrhea. This is when you have to go to the bathroom, but nothing will come out. So we can say you are experiencing constipation or you are constipated. You try to go to the bathroom, but nothing will come out. It's very unpleasant too. And the next one are allergies, and allergies are when something that usually is harmless to most people affects certain people in a way which causes an abnormal response from their immune system. So this could be the person gets itchy or watery eyes as a result of allergies, or they may get skin rashes as a result of allergies, or they may be allergic to certain things like pollen, which comes from the flowers, or pet dander from the pet's fur, or from certain foods. Those are allergies here. And then the next one is indigestion. And indigestion is discomfort or pain in the upper abdominal area. And this can be cause someone to feel nauseous. They experience nausea, and they may have heartburn as well, which is our next item. And this could be the result of eating improperly or eating too quickly, or it could be because of a more serious health problem. And this right here is heartburn, and this has nothing to do with your heart. This is when stomach acid from your stomach comes up through your esophagus, and it causes a burning feeling in your esophagus. Your esophagus runs from your stomach up to your throat. So if you experience heartburn, it's the stomach acid coming up your esophagus, and you feel a burning sensation in your chest as a result. And sometimes this is from eating fatty foods or greasy foods, or eating too quickly, or because of a more serious stomach issue. And my next symptom that someone may experience is dizziness. So this is when someone feels, we say they feel lightheaded, or they may say that it feels like the room is spinning. And dizziness can cause someone to lose their balance, so they may fall down easily if they are experiencing dizziness. And it can be the result of many different things. It could be the result of problems in the person's inner ear. It could be because they are dehydrated, which means they did not get enough water or liquids. It could be because of low blood sugar levels, or it could be changes due to their blood pressure. So that is another symptom here, is someone is experiencing dizziness. They feel dizzy. And the next symptom is insomnia. And insomnia is when somebody wants to sleep, but they can't sleep for some reason. They can't fall asleep, which causes them to stay up late and may affect them the following day. Insomnia can be because of different stresses or anxiety, or it could be because of some kind of medical issue. And our next item is a rash, and a rash is a noticeable change in someone's skin's appearance. And this is often the skin becomes red or becomes itchy. And this can be from an irritation or allergies, or an infection or exposure to some kind of irritant. An irritant is something that causes your body to get something like a rash. So maybe if you're using a cleaning chemical and it gets on your skin, it may cause a rash. That cleaning chemical is an irritant. And my next symptom is an earache, and this would just be pain in somebody's ear. And another symptom is a toothache, which would be pain in somebody's teeth. And although a pharmacy might be the first place you go just to get a pain reliever for a toothache, if you are experiencing a toothache for a long period of time, you definitely need to visit a dentist instead of just a pharmacist to take care of that. And my next item is sunburn. So sunburn is when you are out in the sun too long and you have fair skin or light skin and it causes the skin to burn. And if you have severe sunburn, then that might cause the skin to start peeling off later and can be extremely painful. It can be extremely painful. I hope you never get terrible sunburn. And the next one is a blister. And this is a small fluid-filled bump on your skin. And it's caused by friction. So the skin rubbing against something or something rubbing against the skin for a while. And it can also be from getting a burn. So maybe you're cooking and you burn yourself. It may cause a blister later. And it can be really painful. It can be really painful. And it's really gross to look at. And my next one is a sprain. And this is an injury to a ligament. A ligament is a tissue that connects the bones to each other. And this happens when your body or your joint moves in a way that it usually doesn't move in. So this is a particular kind of sprain called an ankle sprain or a twisted ankle, where the foot turns on itself and it causes the ligament to be pulled in a way it shouldn't be pulled. And after you get a sprain, there may be swelling involved, and it can be very painful to walk on if you have a sprained ankle, an ankle sprain, or a twisted ankle. And my next vocabulary items, I have 3 here. We have cut, scrape, and bruise. A cut is when the skin is broken from probably a sharp object and causes blood to come out of your body. A scrape is when the skin is broken, but blood isn't really coming out of your body. It's not flowing out of your body. And a bruise is when there is a hard impact and there is bleeding under the skin, which causes the skin to change colors. We say that somebody turns black and blue if they have a bruise. You can see the discoloration or the change of color in the person's skin as a result of getting a bruise. And our next symptom is a shortness of breath. And this describes, if you want to describe having difficulty breathing, you may say you are experiencing a shortness of breath. So this could be the result of being sick, or it could be the result of doing a lot of physical activity after a long period of not doing any physical activity. You may experience a shortness of breath. And my next symptom is chest pain, and this is pain in your chest. And if you are experiencing shortness of breath or chest pain, and it's out of the ordinary for you, you probably most likely need to see a medical doctor. You may be experiencing a medical emergency right now. So a pharmacy shouldn't be your first stop. It should be an emergency room. And my next symptom, you may have experienced an insect bite. So you may have a rash on your skin or a bump on your skin, which is itchy, and you may need to find a topical cream to treat that insect bite at the pharmacy. Another symptom may be urinary issues, and this is where either you need to go to the bathroom too many times or it burns or hurts when you go to the bathroom. These are urinary issues, so that is a symptom you may experience and may need help finding something useful at a pharmacy for. The next one are menstrual cramps, and these are abdominal pains that some women experience either before or during their menstrual period. And my next one is anxiety, and this is a mental condition that's characterized by excessive worriedness or nervousness or fear. And this may affect someone's sleep, it may affect their work or their personal life. And anxiety could be mild or it could be severe. And if it is a severe case of anxiety, then you also need to consult professional help for that. So we're getting into our special words here about different kinds of medications that can be found at the pharmacy. And the first one is a prescription. A prescription is written by a doctor. So after you visit a doctor, they write a prescription, and this prescription is either sent to the pharmacy you choose, or you carry this prescription to the pharmacy, and the pharmacist will, what we say, fill the prescription or fill a prescription, where they will take your prescription and fill it. So if it's a medicine that requires a prescription from a doctor, we call it prescription medication or a prescription drug, because it needs a prescription in order from a doctor in order to be given to a patient. And the other kind of medicine I want to talk about at the pharmacy is called over-the-counter medication. And over-the-counter medication or over-the-counter medicines are medicines that can be bought without a prescription. So you can walk into a pharmacy and buy this medication without seeing a doctor first. We call it over-the-counter or OTC medications. And next, I'd like to talk about brand name versus generic. So brand name medications versus generic medications, or brand name drugs versus generic drugs. And a brand name medication is a drug or medication that is under a certain name by a pharmaceutical company. A pharmaceutical company is a company that produces medications, and the generic medication is the non-branded version of that contains the same active ingredients as the branded medication. So the generic version is most often less expensive than the brand name version. So we see here on this bottle, one says Bayer, that's the brand name medication, and it says it's aspirin. Aspirin is the active ingredient in it. And then we have the generic version, which is called aspirin because it's the active ingredient in Bayer. And both have the same safety and efficacy standards that are set by regulatory authorities. And next, I want to talk about dosage. And the dosage for a medication is how much you need to take and how often you need to take it. So a dosage could be once a day before meals or after meals. It could be, once before you go to bed. That would be your dosage. And then next we have adverse effect. Now, adverse effect is a little different than side effect, and I'll talk about both. An adverse effect is any harmful effect from a medication. A side effect could be a good effect from a medication that's not expected, or a bad effect that happens from taking a medication. So all adverse effects are side effects. Not all side effects are adverse effects. There are some medications that have side effects that are actually good. One well-known example is birth control pills. They have a side effect for a lot of women where taking birth control pills will help clear their skin. Clearing skin is not an adverse effect. It's a good effect, but it's a side effect. It's not what the drug or medication intends to do, but it's a side effect. It's something that happens as a result of taking that medication. But adverse effects are always negative. So some common adverse effects may be it causes somebody to lose sleep, or it makes someone drowsy, which means they feel very tired as a result of taking that medication, or they experience maybe vomiting as a result. Those would be adverse effects, bad effects from taking the medication. And next up, we have the expiration date, and you can find expiration dates on medications. You can also find it at things at the grocery store like eggs, cereals, milk. And this is the date in which you should use the medication by. So if you look very, very closely at this picture, I think you can see an expiration date. I think it says December 10th, 2022. So better not take this one. It is expired. It is past its expiration date. And for medications, if they are taken past their expiration date, they may not be as effective as they were before. And my next special item is an allergic reaction. And an allergic reaction is when somebody takes a medicine or medication and their immune system has a reaction to it. So here, this person took this medication and now she has a rash on her arms and her face, all over her skin, because she took this medication. So often when you go to a pharmacist or you visit your doctor, they will ask you, have you ever had an allergic reaction to any particular medications? And that's to make sure you don't take that kind of medication again, so you don't experience an allergic reaction again. And my next up, we'll be going over some different types of medications that are commonly over-the-counter medications available at a pharmacy. The first one is a pain reliever, and this is to make mild pain go away. So if you have a headache, you may take a pain reliever. We use the verb take with medications, not eat with medications, but take with medications. So take a pain reliever. Or if you have a toothache, you may take a pain reliever. Or if you fell down and hurt your hip, you may take a pain reliever to help lessen the pain. Next up, we have cold and flu medications. And these are if you have a cold or if you have the flu, it helps with those symptoms that you are experiencing. So with a lot of these, they have a daytime edition and a nighttime edition, or a day formula and a night formula. And that's because the night one is supposed to make you sleepy. All right, so you can rest well. So here we have a cold and flu medication. If you have a cold or if you have the flu, you can take this and feel a little better. And next up, we have a decongestant. And this is a medication that helps relieve your nasal passage. If you have nasal congestion, your nasal passage is right up here. And nasal congestion is when you have too much mucus way up here in your nasal passage, so it may be difficult to breathe through your nose. And a decongestant will narrow the blood vessels in your nasal passage to allow air to be able to flow more easily through your nasal passage. And next up, we have an anti-inflammatory. So if you have a problem like arthritis, which could happen if you have pain in the joints of your hands or any other joints in your body, it's caused by inflammation in those joints. An anti-inflammatory can help lessen that inflammation, so it is easier to move freely, to move those joints freely. And next up, we have an antacid, and antacids are medications that help with excess stomach acid, and they provide relief if you're experiencing heartburn. Remember, that's where the stomach acid comes up your esophagus, or you have indigestion, so you may need to take an antacid for that. And the next type of medication is a laxative. So remember our symptom constipation, when you really want to go to the bathroom, but you can't. A laxative helps loosen everything up so you can send whatever in your body out through the toilet. Okay, so the laxative is supposed to help you with that problem. And then our next one, if you're experiencing a sore throat or you have a cough, you may need to find some cough drops or throat lozenges to help relieve any soreness or itchiness with your throat or to help you with your cough. And my next special item here is an antihistamine, and this is to counter the effects of a histamine, and a histamine is a substance released during an allergic reaction. So if you have allergies, like this girl, she has allergies to pollen from these flowers. She's experiencing probably itchy eyes, she's sneezing, she has a runny nose. An antihistamine can help her with those symptoms. And my next type of medication you can get over the counter at a pharmacy is an anti-fungal medication. And these are supposed to kill any fungal or fungus infections that are affecting you. So here, this is one for treating a problem called athlete's foot. And that is when a fungus grows on your feet as the result of wearing maybe wet socks or wet shoes for too long. That's a fungus that grows kind of between your toes and in your feet and makes them very itchy, and that's very unpleasant. The next type of medication you can find at a pharmacy are sleep aids, and these are medications to help you fall asleep more easily. So if you're having trouble sleeping, you may need to turn to a sleep aid to help you get a good night's sleep. And next up, we have topical medications, and these are any creams or gels that are applied or put on your skin to relieve things like burns or cuts or scrapes or insect bites. These are topical medications. And the next type of medication you can find are eye drops. So if you're experiencing red or itchy eyes or dry eyes, you may need to find some eye drops to help alleviate those symptoms or lessen those symptoms. And next up, the next type of medication we can find at a pharmacy are nasal sprays. And nasal spray describes any medication that is taken through your nose. So it is sprayed into your nose. Any medication that is sent in that direction is a nasal spray, usually for decongestants to help clear your sinus passage or your nasal cavity up there. And next up, we'll talk about a few sections in the pharmacy or at a drugstore. And our first one is the first aid section. And this would include things like burn creams and bandages and wraps, basically the things you need in your house all the time, especially if you have children, because they're going to fall down, they're going to hurt themselves, they're going to get a cut. And you don't want to rush out for these things after it happens. You want to have them in the house at all times. And the next section I want to talk about briefly is the baby care section. And this would include things like diapers and bottles and formula and pacifiers, things that babies need pretty much all the time. The next section is the feminine care section. And this includes things like sanitary pads and tampons and menstrual cups and things that are designed to address women's health and hygiene needs. And my last section is the family planning section. And this includes products and information related to contraceptives and reproductive health, as well as home pregnancy tests. This would be the family planning section of the pharmacy or the drugstore. So our first dialogue today is called I Have a Cold. You see this person here, he's a customer and he's walked into the pharmacy and oh no, it looks like he's sneezing all over this poor pharmacist right here. This is called I Have a Cold. So I'll go through this dialogue and then there is also a check for understanding afterwards. So we have two people, our customer and our pharmacist. It says, excuse me, I'm not feeling well. Can you help me find something for my cold? Of course, I'd be happy to help. What symptoms are you experiencing? I have a sore throat, a runny nose, and a bit of a cough. I see. We have a few options for over-the-counter medications. Have you taken anything before that has worked for you? Not really. I usually just tough it out. But this time I thought I should try something. So here I underline tough it out, and tough it out when you're sick just means you try to get better on your own without visiting a doctor or without taking any medication. You tough it out. And then it continues, no problem. I recommend a combination of a decongestant and a cough syrup. Let me show you where they are. Thank you. Are there any specific brands you recommend? Well, we have a few popular ones. Here are two options. This one is a daytime formula, and this one is for nighttime relief. Both should help with your symptoms. Just make sure to follow the dosage instructions on the packaging. Great, I'll take the daytime formula. Anything else I should know? Yes, it's important to stay hydrated, get plenty of rest, and if your symptoms persist or worsen, it's advisable to see a doctor. Is there anything else you need? That should be it. Thank you so much for your help. So I have a few questions about this first dialogue. The first one says, what symptoms are the customer experiencing? Why did the customer decide to visit the pharmacy? What kind of medications did the pharmacist recommend for the cold? And what recommendations did the pharmacist give to stay healthy while having a cold? So if you got those, great. If not, check out the replay for this dialogue. And then my next dialogue here, it says, uh-oh, I have athlete's foot. So here we have a soccer player, and you can see these stink lines coming out of his feet. It's because he has athlete's foot. There's some itching and irritation down by his feet. So the same, a customer and a pharmacist. Hi there. I've been dealing with some itching and discomfort on my feet. I think it might be athlete's foot. Can you help me find a cream for it? Of course, I can help you with that. It's important to treat athlete's foot promptly. Are you experiencing any other symptoms? Mostly itching and a rash between my toes. We have several over the counter creams that can help. Follow me and I'll show you the options. Thank you for your help. I've never had this before, so I'm not sure which one to choose. No problem. Here are a couple of popular options. This one contains an anti-fungal agent that targets the fungus causing athlete's foot. It's a cream that you apply to the affected areas. And this one is a spray, which some people find more convenient. Both should be effective. I think I'll go with the cream. How often should I apply it? The instructions here say to apply it twice a day. Make sure to clean and dry your feet thoroughly before applying the cream, and continue using it for the recommended duration, even if the symptoms start to improve. Got it. Anything else I should know? It's important to keep your feet clean and dry. Change your socks regularly and avoid walking barefoot in damp areas like locker rooms. If your symptoms don't improve after using the cream, or if they worsen, you should see a doctor. Thank you for the advice. I'll give this a try. You're welcome. If you have any more questions or if there's anything else I can help you with, feel free to ask. I hope your feet feel better soon. Thanks. I appreciate your help. So if we have 4 questions here about our second dialogue, they say, what symptoms did the customer describe to the pharmacist? What options did the pharmacist present to the customer for treating athlete's foot? How often did the pharmacist advise the customer to apply the cream? And what additional care tips did the pharmacist provide to the customer? So if you got all those, great. If you need a little refresher, feel free to watch the replay after we wrap this up today. And our next special lesson will be all about vocabulary and dialogues about visiting a library. So I hope you can make it for that. That will be next week. And thank you so much, Liao. It's nice to watch your streaming class. Thank you so much. That's very thoughtful to leave a comment like that. Very, very pleasant. Warms my heart. I hope everyone has a lovely weekend, and I will see you next week. See you in the future.